So I am not just an epileptologist. As I said last night when I received my award, that it's very important to be a neurologist as well. You know, the basic training and the interest in other fields. And so I was able to see that my patients with epilepsy were cognitively better with vagal stimulation. And that's one of the advantages. And don't forget, vagal stimulation is approved for depression as well. So back in 2001, and this was right about 9/11, see? And the head of the company of Cyberonics then was at my site. And we talked about this study. Then he left and he had to wait 10 days to get back to the United States. So that's why I know the date, 9/11. And we discussed that they would help us fund an Alzheimer's study. And we did an Alzheimer's study back then, it was very successful. Our patients cognitively better, decreased tau in the cerebrospinal fluid, and then nobody wanted to really go on with it. And so it sort of was dormant until now, when we've been developing a new VNS that's external, that only stimulates the auricular nerve in the, I think we put it in the left ear, but we're thinking about doing other things. And so we randomized in a double-blind way patients with minimal cognitive deficits because of Alzheimer's. So they got the diagnosis of Alzheimer's. And we treated them for 3 months. And there was an amazing, you will see tomorrow if you go to the session, an amazing difference in the cognition. And the patients had this stimulation during the night. So we've sort of now gone on and we're developing this further, because this can be a wonderful thing for people with Alzheimer's to keep them cognitively going for quite some time. We turned off the VNS after 3 months and looked at them again after 3 months, and then they had deteriorated again. But it was in all the patients. It wasn't like one patient didn't improve. And that's what's so mind-boggling. And that's why we sent in a late abstract, and we are one of the 8 or 9 that was approved for an oral presentation.